have natural shape, but if I make too natural, they don't get satisfied because their mom don't even. Well, the reason I do mainly not using the electrocautery at the initial period is because less bleeding and less destruction of. Hi, good afternoon. Nice to meet you. Could you introduce yourself?
Hi everyone, I'm Jolie. I'm a plastic surgeon from Singapore. It's an honor to be here to visit the Choi today.
So for women who are watching this video in Singapore, I think Dr. Jolie has her profession and very enthusiastic in plastic surgery. She knows what beauty is, and I think plastic surgeon has to have a concept of what will be beautiful and pretty. She has a definite concept and definition. So I think a lot of Singaporean women who are thinking of having better results and safety outcomes, I think Dr. Jolie will fulfill your satisfaction.
Thank you. I've been here since November. I just completed my fellowship as a medical center, and now that I have some time after my fellowship, I'm visiting some of the private clinics here to broaden my experience, especially with like aesthetic cosmetic surgery.
So you're going to go back to Singapore and you might do a lot of surgeries based on your Korean experience.
The Korean patients' characteristics are very similar to the patients that we have in Singapore, so very applicable. The skills are very transferable. And
It's very like breast augmentation has principles. I think it's not that complicated, but it's a 3D structure, so we have to think about the projection, the width, the balance, and also the balance between other like shoulder width and also the pelvis circumference. So I think tissue preservation, the reason I do hydrodissection mainly not using the electrocautery at the initial period is because less bleeding and less destruction of the anatomical structures are important for the woman's daily life and their longevity. I think tissue preservation is kind of trendy in every field, not only in plastic surgery, but also general surgery, we do robotic surgery.
yeah, like nose, talking about preservation, rhinoplasty, I think same with the breast as well, yeah. So what I think, it's something that a discussion that I have with my patients. Firstly, to understand what their ideals. Some people want a more natural result. Some would want a more exaggerated result with more exaggerated cleavages. So firstly, to find out their expectations. I think that tools that you have like the chrysalics really helps, as well as patients using the implants with the sizes. It helps to get a gauge of what patients generally want. But I think ultimately we still have to tailor to each patient based on their body's characteristics, their skin and soft tissue characteristics, their pre-existing breast shape, and it's a conversation that has to be individualized to each patient.
I agree with that too. Like every woman have different characteristics, so we have to sterilize every patient's characteristic. So a lot of women ask me when they come to my office, they want to have natural shape, but if I make too natural, they don't get satisfied because their mom don't even realize she had the breast augmentation. So I tell my patient that your friends who graduate your high school together won't notice the size. That will be that very natural. But if your mother doesn't know the surgery, that is too natural. So I advise to have just the natural one, not too natural. It's around like from full B to C in Korean Asian size.
Do you see a trend towards either of this, more patients moving towards fat augmentation versus a hybrid? Right?
Well, it depends on the country. Japanese people want to have more fat graft rather than having breast implant because they still have worries and concern about the implant safeness. But Korea has a lot of implants have popularity among women. The safety is guaranteed, so a lot of women go for implants. China, I think nowadays they go for implants. And hybrid breast augmentation is getting more popular because it gives more natural curve and also softness, not only relying on the size of the implant, but also a mixture of the fat gives you more curvature, more kind of natural curve after the surgery. And also the other part where we harvest the fat gives more slim feature, so I think it has more double satisfaction.
today as well, we saw a mix of implant, breast augmentation, as well as fat grafting. I was quite impressed by firstly how fast it was and how Dr. Choi made it look so easy and seamless. Everything was like a clockwork. Everything went really smoothly and the results are amazing. Yeah.
Thank you.
So I picked up a lot of little tips and tricks from Dr. Choi. So even from selection of the implants to difference between the various kinds of implants, like between mentor and Motiva. Intraoperatively, I think the hydrodissection was a very good technique. And I think even the post-op care, all your little advices and tips would go a long way.
Thank you.
Thank you for all your teaching and generously sharing your knowledge. I've learned a lot.
My pleasure. It was my honor to have you here, and I hope to see you in also future meetings.
Yep.
Yeah.
Thank you.
Thank you. Thank you so much.